Good evening, ladies and gentlemen. Welcome to Triple N Talk Show. I am Dr. Nik Nikam. We are delighted you could join us. And all our programs are video streamed through YouTube and Google+. Please visit our YouTube channel, which is Nik Nikam, where we have more than 900 videos accenting our experience here in the United States. We also have a Facebook page, which is Triple N Media. We would like you to please visit our Facebook page and like it, where we bring you the latest buzz from around the world. Today I have two special guests, and we are going to be talking about muscular dystrophy. And my special guest right to me is Farida Abid. She's a doctor. She's a child neurologist at the Texas Children's Hospital. And next to her is Nina Desai, a good friend of mine. And she was Mrs. Houston. What year was this?
Nick, you bring that up every time.
Yeah.
It's been 2 years now.
2 years?
Yes.
Well, you can't give out the crown you got.
No. I'm lucky I get to carry that.
That's
title
right.
with me.
Okay, Farida, give us a little bit about your background, and then we will proceed with muscular dystrophy.
So, I did my medical school from Pakistan, and I moved to USA in 1998. And I did my pediatric residency here, and followed by the pediatric neurology fellowship. And then I started as a faculty at Baylor College of Medicine, and I'm also a muscular dystrophy specialist. Yeah. And I run the muscular dystrophy clinic at Texas Children's Hospital.
Nina, give us a little bit about your background.
Actually, I'm a registered nurse myself. My background, though, is psychiatric nursing, but with children at that. And I became involved in the muscular dystrophy through Farida. She reached out to me to kind of do the MC for the program. So I'm very honored that I was invited to do that. So.
Okay, that's wonderful. And since this is August 15th, 2016, I should say Happy Independence Day to Farida from Pakistan and to Nina from India. So Happy Independence Day to both India and Pakistan.
Thank you.
Okay, let's start off with what is muscular dystrophy?
Muscular dystrophy is a very debilitating, and some of them are life-threatening condition which affect muscles and cause progressive muscle weakness. And gradually patients or individual get so weak that they cannot function independently. And then they become wheelchair bound, and then due to complication, they can die because of that.
So actually what causes muscular dystrophy?
So it's a genetic disorder. So it can run in the family. There are different types of inheritance. It could be autosomal recessive, and both parents can be carrier, and the child will acquire the disease. It could be autosomal dominant, when either father or mother have the disease, and then the child will have the same disease. Or it could be X-linked, which means that the mother could be carrier and only boys can be affected.
Oh, I see. So that means the parents' genes are defective and they are transmitted to the children, which sort of transforms into this muscular dystrophy in a sense.
Yes. But sometimes you may have de novo mutation, means that the parents are healthy, they are not even carrier, and then child have its own mutation, and that can affect their own genes, and they develop muscular dystrophy because of that. So
are there different types of muscular dystrophies?
There are multiple types of muscular dystrophy, and there are like around 44 types of diseases which can affect muscles, nerves, and the part of the nervous system which can affect your muscle function.
I see, yeah. And how frequently does this occur in the general population?
It depends which type you have. The most common type of muscular dystrophy, which is X-linked, and it runs, only the boys can be affected. It's very common. It's the most common one is the Duchenne muscular dystrophy, and it actually affects 1 in 3,600 to 5,000 boys.
I see. So it's fairly common.
It's very
1
common.
in 5,000 people.
Yeah.
Ladies and gentlemen, you are watching a Triple N talk show. I am Dr. Nik Nikam. We are talking about muscular dystrophy. My special guests are Farida Abid. She's a doctor, child neurologist from Texas Children's Hospital. And next to her is Nina Desai, who is a psychiatric nurse. Is that correct?
That is correct.
Okay. I want to get all this straight, because I don't want to say the wrong thing here. And all our programs are video streamed through YouTube and Google Plus. So please visit our YouTube channel, which is Nik Nikam, where we have more than 900 videos accenting our experience here in the United States. And we also have a Facebook page, which is Triple N Media, where we keep you abreast of the latest happenings in and around the globe, for that matter. Nina, maybe you can start by telling us about that your gala that is coming up in support of muscular dystrophy, and give us some details.
Yes, the gala is on Saturday, September 10th. We are starting at 6:30 p.m. and it's being held at the Emmanuel Martama Church, which is in Stafford. And the gala came about through an organization that Farida and a few of her colleagues are involved with, and they formed, it's called PAMA, which is Pakistani American Association. And really the reason that they decided to join forces with muscular dystrophy was actually because of Farida's two boys. Her sons actually went to the muscular dystrophy camp, which is held every year, free of charge to children that are suffering from muscular dystrophy. It's all funded through the Muscular Dystrophy Association, hence the fundraiser that's coming up to support that. When they came back, they had such an amazing experience. They, knew that their mom worked with these children and decided, spoke with her and made the decision that they wanted to support children with muscular dystrophy and in our community. So what better way to join forces with other physicians, other business people, and support muscular dystrophy? And it happens to be Muscular Dystrophy Awareness Month as well in September. So we are going to be having a wonderful fashion show. We're going to have a Qawwali group that is going to be performing. We will have some speakers there, some who are actually suffering from muscular dystrophy themselves. So it's going to be a fun-filled evening. We will be having a silent auction. So we would invite people from the community to come out and support this debilitating disease.
What day is it going to be?
It's going to be on Saturday, September 10th.
September 10th.
Yes.
So ladies and gentlemen, mark your calendar. For September 10th, it's going to be at, Martoma Emmanuel Church Center,
which is
located in Stafford. And I think you're going to get more details as we continue further. Okay, so let's talk about, you said something about children going and visiting. What age groups are most frequently affected?
So the muscular dystrophy can affect, any age. It does not discriminate between race, ethnicity, gender. We have patients who are born with muscular dystrophy and started having the symptoms right from the birth. And although it's a genetic disorder, but sometimes symptoms can start late. So maybe childhood or maybe as an adult.
In the 70s and 80s, one of the most popular one I used to watch was Jerry Lewis telethons about muscular dystrophy. I mean, he used to raise millions and millions of dollars.
I know.
He had one time he had a global concert.
I think he started doing that in late 60s or maybe late 50s until 2013 and raised billions of dollars to support muscular dystrophy. So let me add to this, why we come up with this idea of doing the Muscular Dystrophy Gala, because Muscular Dystrophy Association does galas every year all over the country. The reason we are doing this gala is two reasons. The one is to bring communities of different culture and religion to come in a fight towards muscular dystrophy, which is a great cause. The second reason is that most of the Pakistani people who are living in the USA are moved from Pakistan, and they integrated and progressed through the society. And our children are growing here, and also this great nation has given us a lot of opportunities, success, education. Now it's time for us to give back in a form. It's like a debt to us, so we have to give back to this society. So the idea basically came like one day I was talking to my son. He knows I'm an MDA specialist, and I said, "Mom, why don't we do like a MDA, like a gala? You should do fundraising for here." And I was like, at that moment, I was like, "This is not an easy thing to do, you know." And I was like, "Okay, well, maybe I should talk to people." So the first thing I did was to talk to MDA Association, like Muscular Dystrophy Association, and they said, "Yeah, you can do that if you want to do a Pakistani American kind of gala." So then this idea came from there, and then we started working on it, and then talking to family, friends, and everybody was so supportive because it's a great idea, great cause. So that's how we come up with this kind of PAMA, which is a Pakistani American Association, and we are really proud to work with MDA to raise awareness and to help find cure for muscular dystrophy.
That's very, 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 heartwarming to see that you're all able to contribute in many different forms besides just medical service to the community. Okay, let's talk about what kind of symptoms do these children manifest with?
So the most common symptom is like if they're born at birth, it's born with the muscular dystrophy, they are usually floppy kids, and then they have developmental problem in the motor skills, acquiring the motor skills, and they become weak gradually. Some of them are more rapidly progressive muscular dystrophy, and some are kind of slowly progressive. So basically they get so weak that their muscles get, so much affected that they cannot even walk or do any motor activities. And because of that, their breathing can be affected. They started having deformities of their foot and back, and so they can develop like scoliosis, foot deformities, and then that altogether can affect their breathing, and they can die because of the respiratory complications. And some of the muscular dystrophy can affect your heart also. So kids can develop cardiomyopathy, which is either the heart becomes enlarged or become more thick and cannot function normally, and say they can die because of that reason also.
Some people think their brain is a muscle. Maybe do you think it's going to affect the brain?
Some of the muscular dystrophy can affect your brain because
I mean, not that it is a muscle, but
it's not directly in a sense that the brain is causing the problem. Is that some of the proteins which is present in your muscle can be actually expressed in the brain. So if you're affecting that protein, then the brain can be affected too because of
Is it that the brain is not sending the signals to the muscles to contract, or what is exactly happening at the muscle level?
Okay, sorry. So main pathophysiology is like it's the muscle disease. So main problem is in the muscle.
I see.
But because there are proteins in the muscle which are also expressed in different organs. For example, the most common muscular dystrophy is the Duchenne muscular dystrophy, and it's due to the deficiency of protein called dystrophin. And dystrophin can express in your heart, in your GI, gastrointestinal system, in your brain, in your retina also, like an eye. So you can have symptoms in all these organs, and these boys basically, because they are the most one affected, can express disease in their gastrointestinal system. They can have some time learning disability, mental retardation because of that. And also the muscle is, becoming weak.
So once they start showing these signs of progressive muscular weakness, how rapidly does this progress to a point where, you talked about being on a respirator and not being able to breathe?
So as I said, there's a wide variety of muscular dystrophies. So some of them are very rapidly progressive, especially if they have some, for example, Duchenne muscular dystrophy. I'm talking about Duchenne because that's the most common one.
I see,
And so these kids actually started having symptoms even before 3 years of age. So they present with difficulty with acquiring their motor skills, and they have developmental problem with walking and running, and then they progressively getting weak. And so by the time when they are 9 to 10 years age, they have so much difficulty that they can end up in the wheelchair. So before 15 years, most of the kids are in wheelchair. The life expectancy is much better now. It used to be like 18 years, 20 years, and I would say 20, 30 years ago. But now it's gradually getting better and better. And recently, we have patients living up to in their 40s.
I see.
Yes.
Yeah, that's encouraging.
Yeah.
Okay, what kind of tests do you really do to diagnose muscular dystrophy? Can we diagnose muscular dystrophy?
Oh yes, we can diagnose almost most of the muscular dystrophy now.
Yeah.
In the era where we didn't have the genetic testing, the diagnosis was by doing the muscle enzyme level in your blood.
Yes, yeah.
But there are certain muscular dystrophy in your muscle enzyme could be normal.
I see.
But most of them usually have high muscle enzyme level. And that does not give you the idea which type you have.
Yeah.
So after that, we usually used to recommend muscle biopsy, which is kind of invasive procedure that they take a piece of your muscle, either from your thigh or from your arm, and then look into under the microscope and then find if there is protein missing there. But because now we are in the era of genetic testing, so there are so many tests available that even without getting the muscle biopsy, we can diagnose certain.
So you can get like a saliva or something to check the genes?
Yes. Now, again, it's changing.
Yeah.
Before it was the blood test. Now there are different kind of testing available, like saliva. You're right. That we are doing that. It's not available in all the labs, but there are certain labs who does. They do like a saliva testing, and it's pretty accurate also.
Yeah. It seems like a pretty, what I should say, is kind of a depressive kind of a disease to have. And it's, as you said, it could be rapidly progressive at times. And once you diagnose, what do we have in terms of treatment for these patients?
Unfortunately, we don't have any cure for this condition. The only treatment is basically supportive, means like preventing the complications, prolonging the life, and improving the quality of life. That's the goal right now. But there are so many research going on. Actually, the Muscular Dystrophy Association is their main goal is to improve the quality of life of these patients and their families, support their families. And also, the main thing is to find cure for muscular dystrophy by supporting a lot of research, both in USA and all over, the world. In last 5 years, there are so many treatments in pipeline which were not there in last 50 years.
I see, yeah.
So it's rapidly evolving field, and hopefully in few years, we will have cure for this condition.
Ladies and gentlemen, you are watching a Triple N talk show. I am Dr. Nik Nikam, and this is being video streamed through YouTube and Google Plus. And please do visit our YouTube channel, which is Nik Nikam, where we have more than 900 plus videos. And please do subscribe to our YouTube channel. We also have a social media page on Facebook, which is Triple N Media, where we keep you abreast of what's happening and around the globe, and also what's happening on Triple N Media talk show and upcoming events. Nina, maybe let's give out that information about your upcoming gala.
Okay.
So then we'll talk about what is in the research in terms of in the future.
All right. Well, once again, we are having a gala in support of muscular dystrophy, and the gala is being held on Saturday, September 10th. We're starting at 6:30 p.m. and it'll be at the Emmanuel Maritama Church, which is in Stafford. Again, that is September 10th, so it is around the corner. We do have a few seats available, not many, but we will accommodate. So we are selling some individual tickets and some tables. And so for that information, if you're interested, you can contact Farida actually at 713-248-8122. Again, that's 713-248-8122. And the gala is on Saturday, September 10th. We will have Pakistani food being served at the gala. We are going to have a fashion show. We're going to have a Qawwali group, and we have some speakers from Texas Children's Hospital and some patients that are suffering with muscular dystrophy. And one of them is an incredible speaker, is what I've been told, and the progress that she's made in her life is incredible. So I myself am looking very forward to hearing her speak. So,
Farida, maybe you can talk about, you already touched upon this in many different forms. What are the complications resulting from this muscle weakness?
So the muscle weakness, cause, as I said, that they lost ambulation, so they are sometimes unable to walk. Even if they are walking, they have a lot of disability because of that. And because of the muscle weakness, their breathing can be affected. Sometimes their swallowing can be affected, so they can have aspiration, and that can cause pneumonia. And that could be the reason, of mortality, means they can die because of that. Again, some of the muscular dystrophy can affect your heart, so you can, develop complication related to that. There are a lot of musculoskeletal problems, like you can have scoliosis, and as you know that when you have deformity of your spine, that can also affect your breathing, and sometimes kids need surgery to fix that problem to prevent complication like respiratory complication or cardiac complications. Also gastrointestinal complication like constipation, they can develop reflux. So yeah, it depends what type they have. Some of them are severe, and some type sometimes they just have muscle weakness, mild type, and they don't have any other associated.
When we come across these kinds of really terrible kind of genetic disorders, it's not only affecting the child, it's affecting the entire family. I did a presentation on what is it? I forget. I forget. We just did a talk show on. I can't get it right now. Anyway, let's talk about the role of family here. Who has a child with a muscular dystrophy.
So you are right that it's just not only affect the child, it affects the whole family, and that's what actually the Muscular Dystrophy Association is trying to do, to make the life easy for the child and also support the family so they can take care of that child. And I really, when you look at these individuals who are suffering, they have really a charismatic personality. I mean, they have goals, ambitions, motivation. I have one patient who is 18 years old, and actually he had a type of muscular dystrophy called Duchenne, and he was in wheelchair, and he can just move his fingers. So he can drive his power wheelchair and able to use his computer. And he graduated from high school with GPA of 4.0. He's going to college, and he wants to do double masters in theology. There's another guy I met who was a 35-year-old, and he was also in wheelchair, and he has a different type of muscular dystrophy which caused severe weakness, and he was also having just movement in his hands, so he can move his power wheelchair. He was not even able to feed himself. His wife was helping him to feed, and he was the consultant in INS, and he was one of the speakers at the MDA meeting. So I get so much really inspired by these individuals. I mean, I learn from them, and I think about like how they are so motivated, and I think it's because of the support they get from their family, and MDA educate them also, and also because of the support from MDA, because MDA actually organize camps for these kids up to.
So you're talking about the Muscular Dystrophy Association. Yes. Oh, okay. Now I got it back. As you get older, there are three things in a sequence you lose. First one is, of course, the memory. That's why I couldn't recall the talk show we had, and that's on autism. Okay. It was a similar, condition. And one of the things we talked about when we were discussing autism was, are there state or federal government funds available to provide continued medical care for these patients?
I think if the patients diagnosed with this muscular diseases, if they don't have insurance, then MDA support them.
Oh, I see.
Yes, fully support them. So MDA actually support the family in case if they need equipments. If they have no medical insurance, then they actually treat them without any cost. So they come to our clinic, and MDA pay for their bills and everything. And these kids actually needs a lot of equipments, like wheelchair, bathroom equipments, toilet, ramps, So MDA actually help them to provide these equipments, and they send people from home care, and they actually evaluate their house and make according to their needs. And so MDA is helping in that.
So it looks like you have a more robust support system for the muscular dystrophy as compared to autism, because they were having a hard time even getting state or federal funds, which are, they were getting a little bit, but not
Yeah, I think it's because of the Muscular Dystrophy Association. I mean, they have a big budget for I mean, they send like thousands of kids every year to camp, and is one kid, the total cost of one kid to send to camp is like $2,000. And then it's like 100 kids per camp, and they have 44 camps all over the country every year. And they don't charge any kid. So their budget come from the fundraising. They do like muscular dystrophy.
So ladies and gentlemen, open up your wallets and do donate to the Muscular Dystrophy Association because it is going for a good cause. And as you can see, there is an enormous cost involved, especially when you're talking about muscle weakness, because muscle weakness can affect every group of muscles, like the skeletal muscles, the heart muscle, and even the muscles involving the intestines and all these different things. Okay, let's talk about, as I said, from 70s I've been hearing about Jerry Lewis raising billions of dollars and all these things. Are we anywhere closer to using genetic therapy or stem cell therapy to modify these genes in these children?
Definitely, because nowadays there are multiple clinical trials on gene therapy for different type of muscular dystrophies and diseases which is affecting muscle, and also the stem cell transplant trial has been going on also, and which has promising result. So we will see what the result shows and when it's going to be, for everybody, like available for everybody.
Here is a more philosophical and more controversial question, maybe you can call it, but as a medical doctor, I think I can ask this one. With parents who are carrying these genes, will they be able to identify during early part of pregnancy if the child is carrying these genes which could be dominant and may manifest as a clinical disease after the child is born, and can they do something?
Definitely, because nowadays
because I don't want to offend any group, but as a medical researcher, they're going to ask us.
Yes, so definitely they are working on it, and there are several. I mean, I would say a lot of the muscular dystrophy can be diagnosed prenatally. Means like once the mom is pregnant, and if she wants to confirm that this child is, affected by this type of muscular dystrophy or any other muscle condition, they can be tested. And even if it's autosomal dominant or recessive or X-linked, all types can be tested.
Okay, ladies and gentlemen, you have been listening to Muscular Dystrophy. My special guests have been Farida Abid, who is a child neurologist from Texas Children's Hospital, and next to her is my good friend Nina Desai, who is a psychiatric nurse. Okay, Nina, maybe you can give the final word on this upcoming gala to support muscular dystrophy kids.
Okay, as you've heard Farida talking about muscular dystrophy and how it affects the child and it affects the entire family. And it's only because of the MDA that these children are able to get the support and the care that they need. And they are being sent to camps all across the U.S. And again, that is because of MDA. So we need your help to raise funds to continue to send these kids to camp, to get them the equipment that they need to function on a day-to-day basis, and to help their families as well. So please come out and support us. The gala is taking place on Saturday, September 10th at 6:30 p.m. at the Emmanuel Martama Church, which is in Stafford, Texas. Tickets are available. We still have some limited seating available. And you can contact Farida for that, and her number is 713-248-8122. And it is going to be a fun evening. We have a lot of entertainment planned. We have some speeches from Texas Children CEOs or executives, and we also have a few speeches from some people that have been affected by MDA themselves, muscular dystrophy, themselves. So please come out and support this worthy cause.
I thought I said you were going to have the final word, but I have to ask Farida one more question.
Oh, okay, okay.
For those people who are like going out of town or not able to make it to the gala, can they donate money on the website?
Absolutely.
Let's talk about that.
I actually wanted to just add to that you can, even at home, you can donate to MDA. You just have to you can go to the mda.org
Yes.
and they have donation you can do there, and also we have a number where you can donate. If you call me and if you want to donate through the credit card, I can provide you that number. You can send check to MDA address, and we can provide you also that address. If you are unable to attend the gala, you can still donate, and it's throughout the year, not just for this gala. Even after the gala, you can donate to mda.org.
Absolutely. Thank you very much,
Thank you very
Farida.
much.
And
Pleasure.
Thanks,
it's been a
Nick.
pleasure
Thank you.
talking to both of you. Ladies and gentlemen, you have been watching a Triple N talk show. I am. Let's see the smooth. Ladies and gentlemen, you have been watching a Triple N talk show. I am Dr. Nik Nikam, and please do subscribe to our YouTube channel and also visit our Facebook page, which is Triple N Media, and like our page. We will see you next time. Thank you.